Iran is facing one of the harshest periods of civil unrest in decades, as widespread protests triggered by economic hardship and political discontent have swept across the country since late 2025. Thousands of people have taken to the streets in cities from Tehran to Isfahan and beyond, defiantly demonstrating against the government despite a severe security crackdown that has resulted in large numbers of casualties and detentions. Rights groups and international observers say the government's response has been brutal. Security forces have used live ammunition, tear gas, and other heavy tactics against demonstrators, leading many injured protesters to avoid hospitals altogether out of fear of arrest. In a worrying development, medical professionals and health workers are increasingly being targeted in the crackdown. Reports from press agencies and human rights organizations indicate that authorities have detained doctors and aid workers who treated wounded protesters. In some cases, hospitals and clinics have been searched for patients with protest-related injuries, and medical staff have reported threats, raids, and arrests. At least 5 doctors have been reported detained by health bodies such as the World Health Organization, and several more have been cited in human rights reports. One recent case involved an ophthalmologist couple in Qazvin who were arrested after providing care to protest victims. Their whereabouts remain unclear, and family members have expressed concern. Another case involved Dr. Amineh Soleimani, a doctor from Ardabil in South Azerbaijan, who was reportedly detained after treating wounded protesters. Authorities have not announced formal charges, and her current whereabouts remain unclear. Rights groups warn that such detentions are intended to discourage medical professionals from assisting the injured and to silence witnesses to state violence. The targeting of doctors recalls earlier episodes in Iran's recent history. In 2009, Dr. Ramin Purandarjani, a doctor from Tabriz in South Azerbaijan, died under suspicious circumstances after refusing to falsify medical reports related to abuse at the Karazak detention center. His case has since become a symbol of the risks faced by medical professionals who adhere to ethical standards under repression. Security forces' pressures on the medical community go beyond arrests. According to rights groups, injured protesters have been rounded up in hospitals or prevented from seeking treatment, and doctors have faced intimidation designed to discourage them from helping the wounded, a trend criticized as a violation of medical neutrality under international law. The situation has drawn international condemnation, with United Nations experts and other observers warning that such actions, detaining injured individuals from hospitals and targeting healthcare staff, violate fundamental human rights and could deter critically needed emergency care. Amid these developments, discussions about accountability, humanitarian protections, and the role of medical workers in conflict zones have intensified, even as the Iranian government maintains a hardline stance on dissent. The growing toll on civilians and healthcare providers highlights the deepening crisis in Iran and the challenges facing its people and institutions.